Welcome to Blocking the Flame, Anakinra and COVID. I'm your host, Gaganasri, and this is episode 9, Anakinra Respiratory Failure, Mechanisms and Clinical Insights. In our previous episodes, we have covered Anakinra's role in targeting inflammation and the importance of timing in treating COVID 19. Today, we'll be focusing on respiratory failure, a major complication of severe COVID 19, and how Anakinra might play a critical role in addressing this life threatening issue. To help us explore this topic, we are joined by Aseema. Let's dive in. Welcome, Aseema.
Thank you so much for having me again, Gaganashri. It's really a pleasure to discuss how Anakinra can impact one of the most serious outcomes of COVID 19, that is respiratory failure.
Let's start with the basics. What exactly happens in COVID 19 that leads to respiratory failure?
Respiratory failure in COVID 19 typically results from acute respiratory distress syndrome or ARDS, as we have discussed before, which is a severe inflammatory condition. In the early stages of the infection, the virus primarily affects the lungs, but as the immune system responds, it triggers a cytokine storm, as we have already discussed as well, which is a hyperactive immune response that floods the lungs with a lot of inflammatory mediators like IL-1, IL-6, and TNF alpha as well. And this excessive inflammation causes damage to the lung tissue and the blood vessels, leading to fluid accumulation in the alveoli, which reduces oxygen exchange, and the lungs are no longer able to provide sufficient oxygen to the bloodstream, which again leads to respiratory failure.
So, the key issue here is inflammation, right? How does Anakinra help in this context?
Exactly, yeah. So, Anakinra is an IL-1 receptor antagonist, meaning it blocks the activity of IL-1, which is one of the key cytokines responsible for driving inflammation. And by inhibiting IL-1, Anakinra helps to reduce the inflammatory response in the lungs, which can mitigate the damage to the tissue and improve the oxygen exchange as well. In case of COVID 19, especially, the idea is that by interrupting this vicious inflammatory cycle, Anakinra can prevent the progression to severe ARDS and reduce the need for mechanical ventilation.
That's fascinating. Is there clinical data that supports Anakinra's role in preventing or improving respiratory failure in COVID 19 patients?
Yes, so there's a growing body of evidence that points to anakinra's potential benefits in treating respiratory failure. Some clinical trials have shown that anakinra, when administered early in patients with severe COVID 19, can improve respiratory function and reduce the need for invasive ventilation as well. For example, in some observational studies, patients with elevated CRP and ferritin levels, markers of inflammation, who received anakinra showed significant improvements in oxygenation and reduced levels of inflammatory cytokines as well.
That's promising.
Yeah.
How do we know that Anakinra is actually targeting the right mechanism?
Oh, that's an important question. So, IL-1 is a central mediator of the inflammatory response, and its role in ARDS is well established in many other diseases like sepsis and autoimmune disorders. In COVID 19, hyperactivation of IL-1 contributes to the endothelial damage and increased vascular permeability that leads to fluid buildup in the lungs. Studies have shown that when anakinra blocks IL-1, it reduces the vascular leak, limits lung damage, and also improves pulmonary function. So, by targeting IL-1 specifically, anakinra helps to manage the inflammation without suppressing the immune system as a whole, which is crucial when trying to balance the body's ability to fight off the virus.
It sounds like Anakinra is actually addressing the root cause of inflammation. But what about patients who are already in respiratory failure? Can Anakinra still help them?
Okay, that's a great point. So, while early intervention is most beneficial, there's still evidence that late stage treatment with anakinra can still offer some benefit in case of severe COVID 19 cases. Some studies have also shown that patients on mechanical ventilation who received anakinra had better outcomes in terms of reduced oxygen demand and improved clinical recovery as well. However, the benefit may be more limited compared to earlier treatment, especially when organ damage is already so extensive. So, the key takeaway here is that timing is really crucial. Anakinra works best when administered before significant lung damage occurs in patients, but it can still provide some relief even in the later stages.
It seems like Anakinra has the potential to both prevent respiratory failure and improve outcomes in severe cases. Are there any risks or side effects we need to be aware of when using Anakinra in these patients?
Well, anakinra is generally well tolerated, but like any drug, it can definitely have side effects. The most common side effects are injection site reactions, which are relatively mild. There's also a slight risk of infection because anakinra can modulate the immune response. That's why careful monitoring is really necessary, especially in patients who may already have a weakened immune system due to COVID 19 or other comorbidities. And it's also important to note that anakinra does not address the viral infection directly, so it should be a part of a comprehensive treatment plan that also targets the virus itself.
That makes sense. So, while Anakinra may be helpful for reducing inflammation, it's important to combine it with other treatments to tackle the virus. As we wrap up, what do you think the future holds for Anakinra in managing respiratory failure in COVID 19?
I think anakinra has a really promising role, especially when we focus on early intervention. The ability to personalize treatment based on biomarkers like CRP, ferritin, and SUPAR will be key in optimizing its use for sure. And more clinical trials are needed to fully understand the best timing and dosing strategies. But the data we have so far suggests that anakinra could be a crucial tool in preventing severe respiratory failure and also in improving recovery in COVID 19 patients.
Well, thank you so much, Aseema, for sharing your insights on Anakinra's potential to help prevent and treat respiratory failure in COVID 19.
My
In our next episode, thank you. In our next episode, we are shifting the lens slightly. We'll look at how Anakinra performs when used alongside steroids and tocilizumab, and what do we know about combining these therapies. Join us as we unpack the science. As always, this podcast is for educational purposes only and should not be considered as medical advice. Please consult a healthcare professional for any clinical concerns. Thanks for listening to Blocking the Flame, Anakinra and COVID. We'll see you next time.